I want to thank Chairman Collins for this hearing and for her testimony, opening statement today. I also want to thank her for the good work she's done on what has been a long week here in the Senate. Every day, 10,000 Americans turn age 65 in the United States of America. 10,000 people every single day. It's a staggering number, and today we'll hear that people turning age 65 face their own staggering number of decisions at that time in their life. They must be thinking about a range of issues, claiming Social Security, also have to be thinking about signing up for Medicare and about how to get what they need to stay healthy. These are not simple decisions. There is no one-size-fits-all choice for those individuals. That's what I hear from my constituents in Pennsylvania, specifically through our constituent service team, and we hear about it day after day. Our office regularly works with Pennsylvanians who miss their window to sign up for Medicare, for example. There are people with a cancer diagnosis who have no way to pay for care simply because they didn't know the right time to sign up. There are people who made an honest mistake, who didn't know they needed to sign up for Medicare. Could happen to any one of us. Now they're paying higher premiums for the rest of their life. Almost 26,000 Pennsylvanians, 26,000, are paying a lifetime late enrollment penalty for Medicare Part B. Nationwide, almost 700,000 Americans are on the hook for that lifetime penalty. The average penalty amounts to almost a 30% increase in a person's monthly Medicare premium. That's outrageous and unacceptable, especially considering that most retirees are already living on limited and often fixed incomes. Medicare is one of America's great success stories, and it's our sacred responsibility to make sure that people can make the most of the Medicare benefits that they have earned. So that's why I introduced the Medicare Beneficiary Enrollment, Notification, and Eligibility Simplification Act. Good news, we have an acronym, the BENES Act, B-E-N-E-S. And what that act does is to make sure that every American receives a notice before they turn 65 that explains when to sign up for Medicare and what can happen if you delay. That's the least that we can do for so many Americans. This bill would also make sure that fewer people experience a gap in health coverage. In fact, this change would update parts of the Medicare law that hasn't been revisited since the program was created more than 50 years ago. So I'm proud of that legislation because it's bipartisan and it represents how Congress should work. What we should hear about, I should say, what's not working and what's most challenging for our constituents. We should design solutions to fix those problems in a bipartisan way, and we should be able to pass these laws because they help the people we serve, the people that deserve that kind of law. So I look forward to today's hearing, and I hope we can illuminate some of these problems and the same problems that Chairman Collins and I can work together on to fix. Thank you, Madam Chair.
Thank you, Chairman Collins, Ranking Member Casey, and members of the committee. Thank you so much for this opportunity to testify today. It is a real honor to be here. My name is Sharon Hill. I'm 63 years old and a resident of Vanderbilt, Pennsylvania. I have 2 sons and 7 grandchildren, and my youngest grandchild, Logan, was born Tuesday. My granddaughter, August, has joined me here today. She is a volunteer with me at many of the senior centers that I go to. I am a volunteer with the Pennsylvania APRISE program. Now, nationally, APRISE is also known as the State Health Insurance Assistance Program, SHIP. In addition to volunteering with the APRISE program, I work cleaning my church. I also care for my 89-year-old father and help care for my 92-year-old neighbor who is blind. I have a disability myself and rely on the support of state and federal programs to remain active and engaged in my community. I've been an Apprise volunteer for 4 years. I initially saw an ad in our local Senior Times newspaper and asking for volunteers to help people with Medicare issues. At that time, I was on Medicare due to a disability and had recently been left with $67,000 in medical bills after a cancer diagnosis. I also recalled the difficult decisions my parents had to make about their Medicare coverage. Both events were behind my interest in volunteering for the Apprise program. To be an Apprise volunteer, I had to attend many training sessions. At these sessions, I learned about the different parts of Medicare, including Medicare Parts A, B, C, and D, as well as Medigap. I also learned about the programs that can help low-income seniors and people with disabilities. This would be like Medicare Extra Help and even Pennsylvania-specific programs that help individuals who have high medical expenses. I was trained on how to use the computer system and enter information into the Medicare Plan Finder. Each year, we receive a refresher training to provide volunteers with any updated information that the insurance companies are offering. However, the more I learned, the more I realized I didn't know. People have a lot to consider when signing up for Medicare, and the decisions can be daunting. I wish I had known about the resources sooner, because if I had known about the program that I'm on now, MAUD, I would not have had the intense medical expenses that I'd had earlier. It is because of my own experiences that I'm passionate about the Apprise program. Apprise is the only place that older adults can go in person to get unbiased information. This helps them with their Medicare decisions. As a volunteer, I give speeches at local senior centers and provide in-person counseling sessions. Each counseling session is 60 to 90 minutes long, and during Medicare open enrollment season, we're very busy. Sometimes people come in with specific questions about their coverage, and other times we are starting with the basics. It is common for people to make Medicare coverage decisions based on the well-intentioned advice of friends, family, or other places. What I've learned during my time as an Apprise volunteer is that people do not have all the information they need to make the best decisions for their health care or financial needs. And making a bad decision when signing up for Medicare can have unintended lifelong consequences. When I see people with gaps in their coverage or seniors paying lifelong penalties, it's often because of misinformation. Knowledge is important in helping beneficiaries maximize their benefits and avoid the pitfalls of lifelong penalties. Thankfully, as an Apprise volunteer, I am trained to help those that are having trouble with their Medicare due to misinformation. We can liaison with organizations to appeal a decision or screen people for programs that help cover the cost of their medications. Apprise counselors not only provide information, they help beneficiaries navigate a complex system and serve as advocates. We also find that once people come to Apprise for help, they come back each year to be sure that their coverage is right. People's lives are changing, and they need to be educated, or they will fall through the cracks. It is because of this that I tell everyone I meet about the program. Apprise counselors do not make Medicare decisions for beneficiaries. We instead provide them with information so that they are able to make the best choices for themselves. Again, I thank you for the opportunity to testify before the committee, and I look forward to answering any of your questions.
Thank you, Madam Chair. Sharon, I'll start with you, and I'm using your first name. I hope you don't mind. We're pretty formal around here, but if you're from Pennsylvania, they can be informal. But I want to thank you for being here and for your testimony. You can tell, I know this is probably the first time you've ever testified. You not only did it well, but you already got action. Senator Collins is already working on something based upon what you said. It's a great country, right?
Yes, it is.
But thanks so much. And I was talking before about the legislation. I have the Bennies Act, and I was struck by a lot of what you said, but in particular, one line jumped out at me. You said in your testimony, quote, people have a lot to consider when signing up for Medicare, and the decisions can be daunting. That's unquote. And that's a pretty good summation of what one of the points we're trying to make today is these are difficult decisions. We're hoping we can pass the Bennies Act so we can prevent common Medicare enrollment mistakes. So maybe if you can elaborate a little bit more on your experience with engaging with people that are trying to make these decisions and the need for clear and easily accessible information to make those decisions. Can you tell us a little bit more about that?
I think one of the funniest things that we run into are when couples come in to do their Medicare, and they think that they have to agree on a plan for each of them. And when they find out they can each get their own plan, they think you've given them, another piece of candy because they're really happy about that, so that they don't have to limit somebody's medical information because somebody else needs more pharmaceutical. And a lot of the things, when you come in, sometimes they don't think they want any pharmaceutical or Part D insurance because they don't take any medicine. And, you try to explain to them that you've got to put something in there because if not, down the line, if you ever do get medication, you're going to pay a lifelong penalty on top of your medication. And then there's decisions. In Western Pennsylvania, we've got the two factions going on. We have the UPMC and Highmark, and you've got to walk people through that distinctions too. Do you want this or do you want that? And this doctor or this hospital that you used to go to doesn't handle this company anymore, so we need to get you, which do you want to choose? And, make that decision. So it's not as simple as going in and saying, I'm 65, just give me something to use. Mm-hmm. Because a year of the wrong program can leave you in a lot of medical distress and bills.
Mm-hmm. Now, and that word navigate that you and others have been using is an apt description, I think, of what some are up against. And in the remaining time I have in this round, Sharon, I wanted to ask you as well, where you said in your testimony, quote, knowledge is important to avoid the pitfalls of lifelong penalties. The reality for a lot of people is you're paying penalties. And we hear about, I said before, our constituent service people hear about this all the time across Pennsylvania. And I know you've seen it up close. Can you share with us why it's important for seniors to have access to not just information, but unbiased information provided by an apprised counselor?
Certainly. If someone comes in to one of our training sessions and they say, I got this letter and it says I have a penalty, well, your heart just sinks because there's going to be a problem. And they end up being in a pickle, more like somebody in a canoe without a paddle, because sometimes when people say penalty, they think, oh, okay, I owe my $10 and then I'm done. What they find out is it's a lot more than $10, and it's every day for the rest of their life. So I don't think that part of it is emphasized enough in the information that we have right now. It's just listed as a penalty. I think it definitely needs to say long-term so that they would know. And also, the problem with the prescription penalties is that if they aren't taking medication, they don't see a need for a prescription plan. But then all of a sudden, 10 years later, they're taking a heart medication. Now they've got heart medicine, which is expensive, and then lifelong penalties on top of it. So it becomes very frustrating. And the best that we can do when we have someone like that come to us is to try to backtrack to see if we can find, did Social Security, did Medicare, did the people's HR department, where was there a breakdown in the information, so that sometimes we can go back and see if we can get maybe a lower penalty, or on rare occasions, no penalty. But it's a long process and a difficult one that people find themselves in, and it's very sad.
Well, thank you very much for that. That's the real life of it. Thank you.